Hi, welcome to Neuroverse
a podcast hosted by Carolina.
and Clara, where we discuss all matters from neuroscience to philosophy and beyond.
Today's episode is on women's health and inequalities in research. And to help us with this episode, we have Anais Kruger-Ruiz, a special guest that is doing her master's at UCL in women's health. Welcome to the podcast, Anais.
Hi, thank you so much for having me.
So, why don't you get us started about what you think are some of the most important points to address in regards to women's health and inequality in research?
So I think before starting, it's important to understand this issue. And it's crucial to look at the history of medicine for this. Medical research has excluded female participants for centuries. And the data that has been collected from people with male sex has been generalized to people with female sex. And that was the norm. So essentially, we've ended up with this healthcare system, among other things in society. We know that we live in a patriarchal society that has been made by men for men. But what we don't really know is that why have women been excluded from research about their own bodies? So we've all taken medications, and what we don't know is that what the package doesn't say is that dosing for nearly every prescription and over-the-counter medication is based on what is safest for men, but not for women. So the reason researchers didn't include people with female reproductive systems in research was because of our overly complicated hormonal processes. That's how they called it. So mainly our endocrine system and the inconvenient factor of pregnancy. As I wanted to mention, it's also really important that we talk about sex when we talk about these differences and not just gender.
Yeah.
Because sex, as we know, is based on chromosomal and anatomical differences, and gender is based on self-representation.
Mm-hmm.
And I think in these two fields, so men's health and women's health, we generalize it a lot to gender when we need to strictly just stick to sex.
Yeah.
Mm-hmm.
Medical research has maintained a discourse that women must be seen as reproductive bodies.
Mm-hmm.
It's actually really interesting because if you see sketches of some of the first skeletons, so some of the first drawings, male anatomy artists intentionally made women's hips look wider and their craniums look much smaller.
Yeah.
As a way of saying oh, hey, look at the evidence that women are just reproductive bodies and they need to stay at home and we can't risk making them infertile, but also not making them too educated. And also look at their tiny heads.
Oh my gosh, I
And
had no idea.
yeah. And it's actually not just that researchers and doctors in medicine have been predominantly male, it's also animal models.
I read a statistic that said it was only until the 1990s that NIH, one of the biggest funding bodies of research in America, that encouraged to use female mice models, not even made it compulsory, encouraged. I think it was only in 2016 that they made it compulsory to include both male and female mice models.
No, but even still nowadays, there are a lot of research centers that they only use male mice because they say their systems are less complicated and the results are going to be not biased because they don't have the hormonal complications or whatever they want to call it.
Something that's so often overlooked and not really talked about or thought about.
Yeah, also going back to the medication, if it's being tested just in male systems, we don't really know how it's going to affect to us. So yeah, that's kind of going back that medicine has always seen women as just reproductive bodies. So our reproductive organs were the only difference to men. And because people with a female reproductive system have reproductive organs, they should reproduce, and all else about them is just uninteresting. Mm-hmm. It's actually really interesting did you know that the endocrine system was actually only discovered in the 20th century? Before, we didn't even know that the women had an endocrine system.
Wow.
It's what produces the hormones.
Yeah.
And that's crazy because diseases presenting differently in women are often misdiagnosed. And those affecting mainly women remain a mystery. And they remain understudied, undertreated. And this has major knock-on effects for both medical practice and the health on us. Personally, I've had quite a lot of experiences of people in my life, women in my life that had conditions that only after many, many years they were actually diagnosed with it. So my mom, she has an autoimmune disease. And only 15 years after she started having symptoms, she got diagnosed. She had an unnecessary operation. She was multiple times misdiagnosed.
I did read this study that said that not only women with dementia received less medical attention, they were also statistically given less analgesia medicine in comparison to men after surgeries. And also, there was a study that showed that it takes an average of 78 years for women to receive a diagnosis of endometriosis, with 40% of women to need 10 or more GP appointments before being referred to a specialist. And it just goes to show that women have to fight so hard to have their voices heard. And there was also studies that shown in pain, like I mentioned, they're given less medication, but also on a subjective scale of like 1 to 10 when describing their pain, they are not taken as seriously as men.
Females and males also generally have different pain thresholds.
We do. Yeah. We definitely do. If you think about it, we need to go through child labor. Yeah. And before the epidural was created,
like the female thresholds are usually higher, yet it takes more saying I'm in pain to get a diagnosis or a treatment.
Yeah, exactly.
Because they either consider us as hysterical. So like with the whole history of endometriosis, before it actually started being considered and like researched and everything, I think it was mainly in the US, GPs were telling women they're just being hysterical about their pain. It's just anxiety, that you're just being hysterical. And of course, endometriosis drives you crazy. It's so painful, but our pain was not being taken seriously, and not even now.
And then this causes disparities in mental health.
Yeah, of course. What I think my fight in this field in women's health is more focused on taking away the focus of just seeing people with female reproductive systems as a reproductive system. Like, we have our health of our own, we have our problems of our own. Our health is not solely based on our reproductive system. So when I started my master's in women's health last year, I was actually really surprised about how we only covered maternal health or like reproductive health conditions, which, don't get me wrong, like I know it's really important, but I ask myself, like, what about teaching young professionals like me or doctors or anyone about, for example, autoimmune diseases? Autoimmune diseases affect 80% of the female population. Strokes and how the symptoms present differently in women. However, practitioners like mistake them for anxiety. STDs as well. All these like diseases that are not necessarily related to our reproductive system, they're not being taken seriously. So like the diagnosis of STDs, sexually transmitted diseases, urinary tract health, mental health, as you said, eating disorders, IBS, people suffering from like psychogenic non-epileptic seizures as well. This is not being taken seriously. I just wonder, how are we not talking about this? Or even, as I said, in reproductive health, the issues of endometriosis is such an important condition and it's widely under-researched, or PCOS, polycystic ovarian syndrome. Actually, if you look at the statistics, the money invested in conditions affecting mostly people with female reproductive bodies is 1% of pharmaceutical research funding. 1%. Wow. And I think this was in 2020. 1% is really, really little. And of that 1%, most of the research is being funded in breast cancer.
Something else I wanted to mention in terms of this diagnostic disparity between females and males, a really good example is autism. So autism is under-recognized in females, that it's always been generally believed that males are just more likely to have the disorder. But now there's more increasing evidence suggesting that it actually may be a diagnostic bias and not a biological effect, because studies have shown that females are more likely to be motivated to learn to conform socially, and so they have the better imitation skills, so that the symptoms are less prevalent because they're able to camouflage basically and act socially more normal than males with autism. And so this is also something that's only recently come into play. Research in autism, a lot of it is in animal models, so like genetic models of the disorder. And only recently has it been really emphasized to look at the female and male differences in these models. But of course, there's also this sort of contradiction between like looking at the biological differences, but also accepting that there are social differences in how societal norms influence how females and males who are affected by the same disorder act. And so this also needs to be taken into account when studying like such a human specific disorder.
Yeah, I mean, these in global health, we call them the social determinants of health. When you're researching any kind of condition, you need to take these in consideration. Identifying as women or being a woman is also one of like these social determinants of health. And
Yeah.
I didn't actually know this about autism. That's really, really interesting.
And I read that one of the reasons why like autoimmune and Alzheimer disorders are so prevalent in women is because it's so highly attributed to the X chromosomes. So given we have two of them, it makes it even more prevalent. And I read that it's to do with chromatin instability, and also the reason it tends to affect women later on in life is because a lagging of chromosome happens. And so, yeah, given we have two of these chromosomes, we're twice as likely to end up having these autoimmune disorders and Alzheimer's diseases. Also, related to what you were talking about, the different medical doses, the FDA found out that there were about 86 different medications that included antidepressant, cardiovascular, anti-seizure medication that were mainly appropriately to be used with men. And it got to the point that with certain of these drugs, women were overdosing on them, and only then they decided to launch an investigation to figure out why. And then they figured out that, yeah, we can't be attributing the same medication to men and women. Women have different types of metabolic systems. We have obviously different like body weights, which take into account. And yeah.
Yeah. And I mean, there's that point, the fact that the medications that we have that are being used for X and Y conditions that react differently to us, there's also so many medications out there that can be used to treat conditions that affect women more. So there's a specific drug which is called metmorphin. It's actually usually used to treat type 2 diabetes and sometimes PCO, so polycystic ovarian syndrome. But there's quite a lot of research that has been found to profoundly decrease the incidence of symptoms linked to endometriosis. These symptoms are pelvic pain, dysmenorrhea. So dysmenorrhea is known as menstrual cramps, and dyspareunia, which is pain during sex. However, there's very low investment in researching if this potential like drug could help decrease the morbidity of people living with endometriosis. But this is not being looked at. Like, we know that this drug could help, but everyone's just looking away and saying, oh, okay, let's look at different things, when we could actually be we're not even fixing the disease, we're helping people that live with endometriosis have a better life when we know that it has such a high morbidity. Yeah, but like in this field, I focus mostly on like autoimmune diseases. So that's my area. And during my master's, I focused my research into better understanding actually the correlation between autoimmune diseases and women's health. So understanding like, why is it that women are more prevalent to these conditions? So as Carolina said, of course, we have double the X chromosome, so that increases our risk. But there are so many other things. And there's actually this very interesting possible correlation between endometriosis and autoimmune diseases. So it's a very, very young theory that says that one can trigger the other. So one of the latest widely presented theories about the pathophysiology is that endometriosis, so we know that endometriosis arises from an abnormal response to inflammatory processes. So the etiology of endometriosis is multifactorial, and abnormalities in the immune system have been suggested to be associated with autoimmune diseases. Yet it remains largely under research. Our immune system has been thought to tolerate self-antigens. However, this quality can be lost, leading to immune-related diseases, damaging our body, which are known as autoimmune diseases. So the progression of endometriosis is associated with local and systemic inflammatory, as I was talking about. So reactions in autoantibodies present in the pathogenesis of endometriosis, and as an estrogen-dependent disease, the role of this hormone in immunomodulation has been thought to increase, as I said, the inflammatory response with women with endometriosis, increasing the risk of autoimmune diseases. It's a very complicated correlation. I don't know if it made a lot of sense. Basically, women affected with endometriosis could have an increased risk of developing an immune-associated disorder. However, we literally know nothing about this, which both diseases affect mainly female bodies. So actually, I want to focus my research when I get into a career of research into this association. And actually, when I was talking to my professors and I was telling them about like my research, what I found about this correlation, they actually didn't know anything about it. And these are like women's health professionals. They dedicate their life to understand women's bodies, and they had no idea about this correlation. And I found that I was shocked about that. Yeah.
Yeah, no, it's incredible how one can trigger the other and how so little is known about it. It'll be interesting to research whether it's correlational or causational.
Also, because we don't know which one triggers which. But I think it would be a good way to understand both conditions separately and together. So more investment into understanding this correlation could help us understand endometriosis on its own and autoimmune diseases on its own. So yeah, so that's why I have started this year to work for like a research company. And my main goal when I started was, okay, so now I'm here. I'm the Robin Hood, if you want to say, destroy the pharma industry from the inside. No. What I wanted to do is just push towards more research or clinical trials or more funding into women's health, and just not only reproductive based conditions. Also, because medical research inequalities don't only affect us cisgender women, it affects non-binary people, it affects trans men and their birthing rights. So it's important to reframe the language around medical care to create inclusive research and language for people that are not being represented. And I mean, we know what it's like to not have representation. So women have been excluded from research and from so many things in our society, but that doesn't mean we should exclude other minorities. So we need to create gender and ethnic inclusive research.
Absolutely. And on that note as well, BAME women tend to get the short end of the stick, and Black women are 5 times more likely to die during pregnancy and birth in the UK, which is horrifying.
No, 100%. And also the pain of BAME women, they're also underrated. So when women go to the GP and say they're in pain, they're less likely to be taken seriously compared to a white woman. And also in terms of mental health as well, that is also a very big issue that's not being considered between these ethnic minorities.
I know that your focus is more on autoimmune and endometriosis, but I was wondering if you could speak a little bit on the vaginal microbiome, because, for example, there's such a big hype right now in research about the gut microbiome, especially like the gut-brain axis. And in the vaginal microbiome, it's also like incredibly diverse and complex with yeast and fungi and bacteria. And things like yeast infections are becoming increasingly more chronic. And to this day, there's so little knowledge about how it works. You can look up probiotics and people don't actually know if it does or does not help yeast infections. And only recently they found out that it is about the increase of yeast in the vaginal canal related to yeast infections, but it's also about the specific type of yeast. So one is more fibrous than the other, and it's the fact that it has this fibrous morphology that is what creates the symptoms. And we didn't know that up until recently. And this is something that's not just happening in the last 10 years. This is something that are symptoms and issues that women have had since the beginning of time, and we still don't know what leads to another. We don't know the consequences of like antifungal medication completely eradicating and wiping out the whole vaginal microbiome, and the other potential effects that can have, then that can trigger BV, bacterial vaginosis. I know from so many friends and people in my life that have had several GP referrals, and what started off as a yeast infection became BV, became a urinary tract infection, became potentially PCOS. Like everything is just so unknown. That's the sense that I have as a woman when it comes to reproductive issues.
Yeah, no, and also as you were talking about the gut and brain connection, there's also a massive gut and the vagina connection. So if your gut and your stomach is not processing well and everything, it will affect your candidiasis. It will give you so many yeast infections. So that connection is also massive, and it's also not being researched. Like, I don't think we know much about that.
Very colloquial, almost like we talk to each other. Oh, I tried this probiotic. Oh, I tried this Coriolis mushroom medication that really helped out, and it shouldn't be colloquial.
No, or also making us completely change our diets. Because people that have recurring yeast infections, they're like, okay, your only solution is changing your diet. I know so many women that have had to completely change their nutrition so they can adapt to a healthcare system that is not really helping them a direct solution to their yeast infections.
I think this is also quite prevalent in that now that I reflect on it, a lot of women's health problems, the solutions are natural remedies, which are historically known to help, and that's fine. But or like dietary changes or like Coriolis mushrooms or etc. But I think this just is further evidence to the fact that modern medicine hasn't taken into account women, so then we end up taking these approaches, which can still be effective, but if the world is working on a modern medical system, then this also needs to change for women.
Medicine approaches, they're correlational. We don't know how it's causational.
There's not enough research as well to understand what they actually do, because there's just a lack of understanding of the conditions themselves.
And I mean, I'm a promoter of natural remedies, but again, we're adapting to a healthcare system that is not working for us. We're just having to take the longer route to find a solution for us. And that's just not how it should be. We should be given the option of like, okay, you have this issue, you have a yeast infection, you can either take natural remedies, but we also have this medical proven solution for you to take, but we don't have that. Of course we have that, but it doesn't work for everyone. But what I found very interesting with all this bacteria in our vagina and our pH levels and everything is the correlation as well with STDs. So GPs assume when you come with an issue, you're like, okay, I'm having like yeast infection symptoms. They assume you have a yeast infection instead of undergoing like thorough research and considering, okay, it might actually be a bacterial caused by an STD. That's not being considered. There's like this bacteria, which is actually quite aggressive, which is called ureaplasma, which has the same symptoms as yeast infection, but it actually causes so many damages. But for example, in the NHS, you actually cannot get it tested through a public healthcare system. You would have to go to a private clinic. You have to find out on your own. You have to think through, okay, it's not yeast infection because it's not working. It might actually be this and this. And then you go and get tested. But what about the people that don't have this knowledge? What about the people that are just like, oh, okay, it's not working, let me try other remedies. But we don't know that it might actually be other bacteria causing this. And I find that very worrying as well.
In the society that we live in, if we have a problem, we tend to go to the doctor. We don't tend to go to the most local like mushroom market, and
I wish I had a local mushroom market.
It would be great.
No, I have nothing against natural remedies. I just think that if the world is going to be based on modern medicine, then why should certain population be left out of that?
And it's also doctors should be informed that there are these traditional medicines that do work, as opposed to just prescribing an antifungal that completely wipes out, that completely dysregulates your equilibrium. Because it is an equilibrium, it's a balance. In the same way that if you go on antibiotics, you then should take probiotics to help balance everything out. You take antifungal medication and then who knows? I also wanted to talk about this one other study that I thought was really interesting and relates to what you were saying about how the focus shouldn't just be on the reproductive system with people with a female reproductive system. And so Natalie Rochford did this experiment on mice, and they water and food deprived them. And they saw that in these mice, in the male mice, that when you show them a visual stimuli and it had like horizontal bars, for example, and you shifted that by 10 degrees, and if these mice were water and food deprived, they wouldn't be able to tell the difference between the straight horizontal bars and the shifted 90 degrees. So they weren't being able to do this thing called predictive coding. So their error in the visual processing wasn't working. So they were perceiving these two stimuli as like the same stimuli. They weren't being able to differentiate between the difference of the 10-degree angle. And this was to do with the metabolic stress that was happening. But they noticed that with the female mice, this didn't happen. Food and water deprived female mice were still able to differentiate between the two stimuli. And they then looked into it further, and they realized that this was because the metabolic stress, all of that was simply going straight to the menstrual cycle. The menstrual cycle was the thing that was suffering. And so we don't know this connection between the hormones, the menstrual cycle, and the brain and the visual processing and predictive coding.
No, I was actually reading a book. It was called The Gendered Brain. I think I recommended it to you, Kara. And it was just talking about like the sex differences in our brain. Because the sex differences have been in our brain have been used as an excuse to put us like under.
Yeah.
But I mean, we know that there are differences in our brains, but we don't actually know 100% what they are, how do they work, what they do, and
I think gender studies in neuroscience are a particularly useful link to neurosociology as well. Like, how have differences inherent to our biology and our brains led to the development of society in this way? I think this is also something that's interesting and also very useful for understanding, just how societies have developed.
Yeah. It was super nice to actually talk about this issue and put it out there. I think it's really important that people hear about the inequalities in healthcare. And I mean, we were now focusing on like the sex inequalities, but just like ethnic inequalities are major as well. I think that's also a super important topic that needs to be talked about. And yeah, no, let's just keep pushing towards more equality in medical research. That's all I have to say. So much for having me. That as well.
Of course. Thank you for joining us on our podcast. It's been a pleasure.
Thank you so much for sharing your knowledge and your passion as well.
Yeah.
I mean, we all still have so much to learn.
Yeah, absolutely.
Thank you for listening to today's episode. If you enjoyed it, do check out our Twitter account and Twitter and Instagram, and support us on our Ko-Fi page.
And do check out the website for additional resources, the papers we talked about, and do fill out our Google Sheets form so you can help us keep improving the podcast. Thank you.